1.
Hi, I'm Spencer, and this is our Ethics Committee's case analysis. Ms. Johnson is a 73-year-old female who presents to the emergency department with low blood pressure, and she was only alert to self, not knowing the year or location. She has a history of poorly controlled heart failure and no formal documentation of cognitive impairment. The CT scan reveals a small bowel perforation. She was given IV fluids that improved her blood pressure and mental status and was able to speak to the medical team. General surgery recommendation recommends urgent surgery to repair perforation. The surgeon explains the risk of surgery and survival rate of 20% due to her medical history. Ms. Johnson is a practicing Catholic. She refuses surgery and states that she wants to home, have dinner, and die. She doesn't want her son, Brian, to be contacted about her condition. However, she does not appear to fully understand her condition, consequences of refusing surgery, and why she doesn't want her son to be contacted. Later, her heart attack and blood pressure dropped. She was given medications to stabilize her vital signs, but she was no longer able to speak. The surgeon called her son and informed him of his mother's condition. The next day, Ms. Johnson was upset that her son was contacted, and she continues to refuse surgery. But her son insists that the surgery must be done. I am presenting from the chaplain's perspective in the case of Ms. Johnson. Ms. Johnson is a 73-year-old woman with advanced heart failure and small bowel perforation. The surgeon tells her that without surgery, she will die, but that with her surgery, her chances of survival is about 20%. She is stabilized and she is able to talk and clearly states that she wants to go home, have dinner, and die at home, and does not want her son contacted. As a chaplain, I am not the person deciding about surgery, but I am focused on all of this. I'm focused on what all of this means for her as a person. My role is to explore her spiritual beliefs, her fears, her hopes, and what good death looks like in her eyes. Miss Johnson is a practicing Catholic, and she says she is at peace with dying. That tells me that her faith is central and she understands what is happening. I would want to understand how sees suffering, how she sees medical treatment at this stage of life, and how she understands being ready to meet God. I would also serve as a bridge between Miss Johnson, her family, and the medical team, so that her spiritual values are visible when hard decisions are made. On this slide, I want to focus on the spiritual, emotional, and relational concerns that might be driving Miss Johnson's refusal of surgery. First, when she says, I want to go home, have dinner, and die at home, I would not assume that this is a simple denial. As a chaplain, I would ask open questions like, what would it mean for you to die at home? And what are you most afraid of right now? This helps her name whether she's more afraid of pain, of losing independence, of being in the hospital, or being a burden to her family. Second, her Catholic identity matters. In Catholic teaching, a person is not required to accept every possible treatment. If a treatment feels excessively burdensome, there's a little hope of benefit. It can be morally acceptable to refuse it. For Miss Johnson, a very high-risk surgery with low chance of survival might feel like a burden rather than a benefit. My job is to help her express that in her own words. Third, there's a clear relational tension. She did not want her son contacted, yet he is now present and strongly pushing for surgery. I would explore gently what the history is there. Does she feel that Brian will not respect her wishes? Is there guilt, anger, or past hurt involved? With Brian, I'd provide space for him to share his fears of losing his mother's and his hope with how the surgery might save her. I would try to help him hear that his loving mother may also mean honoring what she says and what she wants at the end of her life, even if it's very painful for him. Thank you.
Alrighty. My name is Michaela Epps, and I will be assessing the legal implications of the power of attorney and how advanced directives operate within the medical field. So, attorneys provide a unique perspective in the healthcare field as they can provide individual representation, institutional representation, such as for a hospital or administrative agency, or engage in medical aspects such as regulations and legal advice for physicians and patients. In the case study of Ms. Johnson, the role of an attorney for this case would be to determine who has the power of attorney for Ms. Johnson, assist the physicians who are determining incompetence of Ms. Johnson, and create advanced directives to guide medical decision making. When assessing a patient to determine the level of impairment, which also determines the level of incompetence of the patient, it is necessary to meet 4 legal standards of decision making capacity. The first is the patient must be able to clearly indicate their preferred form of treatment. If the patient is changing their mind consistently due to certain conditions, this may indicate a lack of capacity. In Ms. Johnson's case, she is indicating a choice to not receive further treatment, but she cannot communicate following the drop in vitals. The second criteria is that they must understand information being communicated to them by the physician. So in the case of Ms. Johnson, it is expressed that while she is saying that she does not want to receive further treatment, she's not really aware of the severity of her current treatment. The third criteria is to appreciate the severity of the medical condition and how treatment options can impact the patient. In a situation where the patient is not able to acknowledge their illnesses or are not capable of making informed decisions for treatment, the court systems have a legal obligation to then determine who is going to be the attorney or have the power of attorney for that patient. So in the case of Ms. Johnson, she is not fully understanding the consequences of refusing that surgery and how it could lead to her untimely death. The final criteria is the capability of the patient to rationally process and determine treatment options. While patients are allowed to make unreasonable choices, it's more important to understand how a patient comes to the conclusion about their treatment paths. So while Ms. Johnson is allowed to say, I do not want the surgery, there also needs to be an understanding of how she came to that conclusion, whether that be because she doesn't understand or she just ultimately is like, you know what, I'm ready to end my life right here. So in this case study, Ms. Johnson is only able to communicate her desires when her heart rate and blood pressure are stabilized by IV fluids. She is not able to show full understanding of how critical her current condition is, as well as what potential consequences can happen if she refuses the surgery. With these 4 criteria not being met, Ms. Johnson must be deemed incompetent to make medical decisions, leading her son, Brian, to act as her healthcare power of attorney. So now we're going to get into what power of attorney is and how advanced directives work. Lawyers are able to determine who has healthcare power of attorney for their client, as well as advise and assist in creating advanced directives. The definition of power of attorney, whether that be general or healthcare, is defined as a person or organization given power to act on another person's behalf, typically written in writing ahead of time by the individual who needs that proxy. The advanced directives are the written form of legal instruction, which are given to guide healthcare professionals in situations where the individual is terminally ill, injured, near the end of life, or cannot make their own cognitive informed decisions. Unfortunately, less than 30% of Americans create or complete an advanced directive, which can leave physicians unable to confidently complete care as necessary. Surrogate medical decision-making requirements vary from state to state across the United States. However, the typical order is spouse, then the adult children, then the parents, then the siblings, and then additional relatives. In the case of Ms. Johnson, because she has no living will or advanced directive, the power of attorney, after she is deemed medically incompetent to make her own decisions, moves to her closest relative. Her husband has passed away, which then makes her son, Brian, who she lives with, her proxy for medical decision by default. Under Pennsylvania law, which is where they're currently residing, Brian must follow the general rules of having power of attorney, which include acting in accordance with the principal's reasonable expectations to the extent known by the agent, and otherwise in the principal's best interest, to act in good faith and act within the scope of authority granted in the power of attorney. So hopefully, Brian will act within the interests of his mother, but because she is expressing something different from what he is, she does not want the surgery, he does, this could cause a little bit of a rift. So, applying the four-box model here, her medical condition is life-threatening, and without surgery, she will die. There is a small bowel perforation, and the surgery survival rate is 20%, which means that death is going to be expected without the surgery, and there's also a high possibility that she will pass away during the surgery. The patient verbally states she wants to go home and die. However, her mental status is questionable because she cannot explain her reasoning and understanding of the consequences. The quality of life may not align with her values because there is frequent hospitalization due to heart failure. There's a high risk of poor recovery after surgery, and there's an aspect of, the dignity, comfort, and spiritual preparation that she is coming to towards the end of her life. The contextual features are that she is a practicing Catholic and at peace with dying. She does not want her son to be contacted, and there's also a conflict in her decision-making capacities. So for patient preferences, the key question is whether Ms. Johnson has decision-making capacity, which the attorney would deem not necessary. If she is found to lack capacity, then we move to the surrogate decision-making, and we should try to have her son match her values in prior statements, including her wish not to have aggressive treatment at the end of her life.
All right, hi, my name is Tape, and together we'll examine the role of an ethicist in this case. My role as an ethicist is to evaluate how healthcare team balances ethical principles, examine the ethical conflicts that arises between patient autonomy, family values, and clinical recommendations, as well as ethically guide in decision-making and ensuring the patient's rights are respected while protecting their well-being. The core principles of medical ethics are to respect patient rights and choices, promote well-being, and avoid harm, and treat all patients equally and fairly. In this case, the medical ethics principles conflict because Ms. Johnson refuses surgery, which is her right to make choices, but this could lead to preventable death. Due to her fluctuating mental status, legal requirements should be considered while maintaining ethical standards of care. The main conflict is between honoring Ms. Johnson's stated wishes and her ability to fully understand her decision. Her fluctuating mental status raises concerns about whether her refusal is informed and stable. However, forcing surgery would violate autonomy principle if Ms. Johnson is determined to have full capacity. Therefore, questions and concerns arises about Ms. Johnson's decision-making capacity, including if she understands her medical condition, consequences of her choices, and reasoning behind her options. Therefore, the correct ethical steps must be taken, and that would be a capacity evaluation. As an ethics committee, we have reviewed Ms. Johnson's case from different perspectives. The chaplain recommends involving an ethics consult, complete a capacity assessment, and developing a plan that either honors her informed refusal with strong comfort and spiritual care. If the surgery proceeds, her values and faith should be at the center of the conversation before and after the procedure. And the attorney recommends that by utilizing the capacity evaluation, if Ms. Johnson is found to lack capacity under Pennsylvania's state law, and the help of her emergency care physician, her son Brian would become the healthcare power of attorney. The best thing that the lawyer can do is encourage Brian to make decisions that are within his mother's best interest while still attempting to honor her wishes. As an ethicist, my recommendation is to determine whether Ms. Johnson has medical decision-making capacity, meaning she fully understands her condition and consequences of her choices. If she is determined capable, then ethically we must respect her decision, even if it results in death. However, if she lacks capacity, then a legally authorized person or a power of attorney should make the decisions on her behalf. And then here we have our references. And then I'll end it off by saying thank you for listening to our ethics committee presentation. We believe this would add value to our practices as future healthcare providers.
Thank you.
Thank you for listening.